So the trial partners have worked really hard to put together their presentations and to tell you about the work they've been doing. And that can be a really lonely job when you're speaking to what you know is 400 people, but you're doing it on Zoom and everybody's muted and you can't see them. So at the end of the presentation, I will ask you to show your appreciation by using the clapping button you can find at the bottom of your screen, okay? Now, those of you who were here last time, I did ask you last time to turn your cameras on and to clap in real life, but some people told us that the effect of turning lots of videos on at the same time was really unpleasant. So huge apologies for that, and we won't do it again. So just to reiterate, keep your camera off, but when people have finished their presentation, I will invite you to use the clapping button you can find at the bottom of your screen. So let's have a little play with that at the moment. Can you find your clapping button? I'm going to find mine. There we go. Everybody try their clapping button. I see any clapping. The people I've got up on my bit. There we go. Some clapping. Well done. Go, Jordan. Maples, Kyla. Great. There's some clapping there. Fantastic. So I know it'd be lovely to have a big kind of, you know, round of applause for people, but it does make it really distracting. It could be really overwhelming. So we won't do that. Just know, those of you who are presenting, that we're sharing the love of what you've done. So we haven't started recording yet, but after the housekeeping slide, we will be recording the session. And we will share the recording afterwards with everyone who's here, and then it will be on the Health Education England website. Questions. We had invited you to ask questions in advance. As I said, we will be answering some questions towards the end of the session. However, there is already a frequently asked questions document setting out the answers to questions that we've already had from our previous stakeholder forums on the Health Education England website, okay? So we'll answer as many of the new questions as we can. Please do use the chat for any questions that come up for you, okay? You're really welcome to do that. And we will collect those. We won't answer them directly today. We will collect them and we'll add them along with any other new questions to the frequently asked questions document within the next 3 weeks. And anytime you've got a question about this, it's really worth going to the website, because those frequently asked questions do get constantly updated. Can I also really encourage all of you, if you haven't done already, to go to the Skills for Care website and sign up for the workforce updates for services that support people with learning disabilities, autistic people, or people with learning disabilities who are also autistic. That means you'll get all the updates about this work automatically. Okay, I think we have started recording. We have, but just in case, we're starting recording. Okay. The first thing that I'm really excited to share is a short video from Dr. Amir Khan. Now, he can't be with us today, but he wants to say a few words in support of this training. Now, Dr. Khan is a full-time NHS GP and he works in Bradford, and some people might recognise him from the TV series GPs Behind Closed Doors. He's also a regular on This Morning with Lorraine Kelly. Amir is passionate about the work this programme is doing and about the training that GPs will be able to receive. So I'll just hand you over to the video now.
The Learning Disability Mortality Review has repeatedly told us about the health inequalities that people with learning disabilities and autistic people face. As a GP of many years, I recognise that we need specific training, just like our colleagues across health and social care, to gain real understanding about learning disability and autism and the nuances around this. We need to have the confidence that people we refer on to can recognise the real needs of people and make the adjustments needed to provide the care and treatment everyone needs. It is vitally important we have quality training to give us essential skills in supporting and understanding our learning disabled and/or autistic communities. It is important that we are given the skills to work in partnership with them to ensure that they have the best possible health and social care outcomes. One of the things I'm delighted about is that the Oliver McGowan training is co-produced and co-delivered alongside learning disabled and/or autistic people, making it meaningful, not only to those who receive it, but also those who are delivering it. We can only gain real understanding about learning disability and/or autism by listening to autistic and/or learning disabled people. I know the trial partners are updating you on what they have done so far, how the training is progressing. It's great to get regular information along the way of how things are developing. I'm personally looking forward to receiving the training when it's rolled out and seeing it make a real difference in practice. I know a lot of information has been shared already, and the stakeholder event will be another way of making sure people are engaged with Oliver's training. But I can't stress enough to ask for you to continue to spread the word. Tell people it's coming. Let people know it's happening and that it will make a real difference and save lives. Thanks to everyone for their efforts so far and their continued dedication to this work. And I will personally be letting people know about it within my networks and look forward to the training when it's rolled out.
How fantastic to hear such great support from a high-profile GP and how useful that's going to be going forward. And what an amazing garden he's got. I'm just a little bit jealous about that. Okay, I'm going to hand you over to Paula McGowan, Oliver's mum, to start us off today. But can I just ask one more time, if you're not presenting, please could you turn your video off? That'd be really, really helpful. Thank you so much. Paula, over to you.
Thank you, Tricia, and to everybody attending today. Welcome. What a fantastic number of people we have registered, 700 in total, which is just absolutely fantastic. Now, I would personally like to thank every single one of you for your interest and support. And as my friend Dr. Amir said in the video, it's so vitally important that we all continue to spread the word about the Oliver McGowan Mandatory Training and the value behind it, not only for GPs, but for everyone who works in health and social care. Please remember that learning disability and autism is, after all, everybody's business. The Oliver McGowan Mandatory Training is about all of us working together collaboratively, side by side, alongside our learning disabled and our autistic communities. It is about us learning from these very communities in exactly how to better understand learning disability and autism and how it affects them. Oliver's training, and I think you will all agree, is about changing culture, challenging culture, changing hearts and changing minds. I would like to thank our partners, Gloucestershire Health and Care, MENCAP and the National Autistic Society, Pathways Associates, the British Institute of Learning Disabilities and NDTI, who will be presenting today and updating us on progress on how Oliver's training is actually co-produced. I'm now going to hand you back to Tricia, who will take us through the rest of the event. I hope that you will all find it not only informative, but will leave us today with a real fire in your belly to be a part of making Oliver's training the very best it can be. Thank you, everybody.
Thanks so much, Paula. Now, as we all know, the Oliver McGowan Mandatory Training in Learning Disability and Autism for all health and social care workers has been developed as a result of the untimely death of Oliver McGowan, and recommendations made in the second Learning Disability Mortality Review report in May 2018, which highlighted the health inequalities and early deaths of many other autistic people and people with a learning disability. The requirements for the training are set out in Right to be Heard, the government's response to the consultation on learning disabilities and autism training for all health and social care staff, published in November 2019. And it's a testimony to the hard work of many people that we're here today, hearing about the reality of what the training could look like. So you're going to hear in a minute presentations from the four places, the four partners who are working really hard to try out developing what the training could look like. There are some videos as part of the presentations, some video clips, and we know that the quality of video can depend on your internet connection. So please don't worry if the quality isn't great for you. You will be able to watch them later when we upload the recording onto the Health Education England website. So really excited to introduce you to the first of the trial partners. So it's our colleagues from the British Institute of Learning Disabilities. So we've got Catherine, Lindsay and Joanne. Off you go, guys. Thank you so much.
Morning, everybody. We're going to talk to you today about the Build-led Consortium for the Oliver McGowan Mandatory Training Trial. The Build-led Consortium is made up of all the partners that you can see in the logos in front of you, and these partners have all been really important in helping us create and develop our training and in helping us steer our whole trial. So we thank them very much for their commitment and support, and without them this trial wouldn't have the important impact that we want it to have on people's lives.
Okay, so I'm Joanne. I'm a person with a learning disability and lived experience, and I volunteer for Pathways. Lindsay?
Thanks, Joanne. My name's Lindsay and I work for Build, and I'm leading on the trial for the Build Consortium.
And we have Anna, but she's not here today. Amanda from Choice Support, but she's not here today, so we have a video to show her.
Thanks, Joanne. A quick update from me. So where we're at with the trial now. So everything we have done so far has been co-produced with people with lived experience. We've created a number of sessions that we delivered, test sessions that we delivered mostly in the early part of this year, and then we made some changes to that training, and we've now begun to deliver our understanding sessions. So by that we mean our understanding autism or understanding learning disability sessions, and we hope to begin to deliver our more in-depth training or tier 2 training in July. So just a little bit about what the tiers are, the difference between the tier 1 and the tier 2 training. So the tiers come from the core capabilities framework for supporting either autistic people or supporting people with a learning disability. And the tier 1 training that we're talking about is the understanding level. And that training is designed to be for all staff working in health and social care that might come into contact with a person with a learning disability or an autistic person. So that might be a receptionist, or it might be a frontline healthcare worker, social worker, support worker, doctor, nurse, anyone at all. It could be a manager, could be anyone. The tier 2 training is more in depth, and that's designed to be for our health and social care professionals and support workers, so those people who are providing support. So again, those people working across the board in universal services, but those people who are having more interactions with either autistic people or people with a learning disability. Joanne, over to you.
Okay, why today I want to talk about why did I want to take
Why we wanted?
Why I wanted to work and train the staff in services, how we came partners together, and what things of the training we did.
What you think of the training now?
Yeah,
that's great. Thanks, Joanne. Do you want to tell us, Joanne, why you wanted to get involved in the Oliver McGowan Mandatory Training?
I heard the story of Oliver and what happened to Oliver. I wanted to help to make services better for people with learning disability and autism. Yeah,
it's really important, isn't it? And it's a really, really sad story. So when you were working with us to do some of the co-production, what did you do, Joanne? How did it work?
So we had a team in Manchester. We are a team in Manchester, and we met regularly on Zoom to start working through looking at material to start helping you to put material. So we started with that, and then we went to the big panel, didn't we, with you, with Lindsay, and we met as a big panel to say like what we wanted in the training, what we'd not agreed, what we didn't want anymore, what we didn't like.
That's right. And so you came to those bigger groups after you talked in your smaller group, and you said what you wanted in the training and what you didn't want, and what you liked and what you didn't like. And did we go away and make those changes that you'd asked us to?
Yes, we did.
Yeah. And do you think that was it sometimes tough to have to talk with other people and make agreements? Did you have to work through some issues, or was everybody much in agreement, do you think?
I think everybody was in agreement, weren't they, with it?
Yeah, it's really good. It's really good. People seem to want the same things, which is a good sign. Okay. And so now you've seen the final training. Now we've gone back and forward and made all those changes and tried to make it the best it can be. What do you think of it? I'm
looking forward to delivering again.
Yeah.
I'm really looking forward to delivering again and delivering tier 1 and tier 2 eventually. Isn't it?
Yeah, we're really looking forward to you delivering the training too, Joanne. I think it's going to be really good. Yeah. And do you think it covers everything that people need to know about learning disability?
Yes, it does. Yeah.
Good. Good. Thanks, Joanne.
Oh, I'm going to get this right. Amanda's video.
We're going to hear from Amanda. We asked her the same questions, didn't we? So we'll hear from her and hear what she has to say.
I wanted to become involved in the training because
I think it stopped, Linda.
I think that I've got problems with my internet and I don't know.
As an autistic person who's been in hospital myself many times, both medical and psychiatric, I've frequently had my needs as someone with autism either misunderstood or not acknowledged at all. And I'm acutely aware that tragedies like what happened to Oliver McGowan can happen all too easily. So I wanted to do what I could to help educate others about autism and therefore hopefully reduce the chance of something similar happening again. The co-production process was interesting. There was a group of people, mostly people with lived experience of autism and some who were parents or carers of people with autism. Initially, we looked at some existing autism awareness training packages to decide what was positive about them, what we could include again and what was not so positive. And then we had a few meetings over video call to discuss what we felt were the most important things to go in the training. It was a bit of a challenge doing it over video call with the pandemic because some people with autism struggle with communication, and with us all being quite new to each other on video call, it was difficult, but we managed, and I think we got something quite effective together in the end. Generally, the group was very good at hearing everyone's points of view. We had some very interesting discussions about what sort of language we should use because people came from quite different opinions. But yes, I think the group was quite good at hearing what everyone had to say. Seeing the training materials at the stage of development they're at now, I think it's a good start for getting the wider population educated about autism, particularly those in healthcare. But I still think there's a long way to go in getting this training delivered across a wide selection of society, and also maybe developing further more in-depth training for people who are going to work specifically with autistic adults or children. I think this training has the potential to at least get thoughts about how an autistic person might perceive the world differently to someone without autism, but it does need to be rolled out quite widely, and I think it needs to start a conversation. It's not a be-all and end-all that once someone's had this training they know everything about autism.
Thanks, Amanda. So we wanted to make sure that, as well as having lots of people with lived experience helping create our training and deliver our training, that we included as many other voices of lived experience as possible. So we worked closely with a group called Open Storytellers, who recorded 20 people telling their stories of their experiences with health and social care services. And we worked with a very talented artist named Robin Meader, and you can see his photo here, who helped create animations to bring people's stories to life. And by doing that, we hope we've brought a real richness to our training, from hearing lots of different experiences and different stories, because not everybody's experience is the same, and we want to make that really clear. So we've got some snippets of some of the stories to show you. They're not the full story, so just be aware of that. They're just some snippets to show you, to get a flavour of what they sound like.
We are all different.
Everybody with learning disabilities is not the same. We're different. Some people have less communication, some have none. Behaviour is different. You don't judge the book by the cover.
I love you, the dentist. Chair. It goes up and down, it goes back and it goes up. It goes up and it goes back. It goes back and it goes up. Fun. Scared of needles. I'm always scared of needles. Because they have those big lights that they turn on.
Went into the hospital to ask whereabouts I got to go to, and they were very happy, cheerful, and they sent me where to go, and I said, thank you very much.
My GP is really good, you know, he's really careful with me. Any other person, I can't trust them.
So what's happening next? Now we've created our training. We really want, as Joanne says, to go and deliver it really over the next 6 months. So mostly in Greater Manchester and the West Midlands will be delivering our training. And as I said, people with lived experience will always be co-delivering our training. But in addition to that, people with lived experience are also checking internally that our training is good quality when we deliver it. So that's in addition to the work that NDTI are doing with their external evaluation. We're also quality checking with people with lived experience and subject matter experts inside our training as well.
So I'm really looking forward to delivering the training. I hope I possible hear more what people say.
That's lovely. Thanks, Joanne. Thanks everybody for listening to us.
Oh, thanks, guys. Fantastic. That's absolutely brilliant. Let's use the clapping function to show our appreciation. Your button at the bottom. Let's see some clapping hands. Lovely. Thank you. Thanks so much. There's some lovely comments in the chat. Some really right observations about how when co-production works, isn't it amazing? So absolutely lovely, and lots of comments about the videos and the animations as well. So fantastic. Thank you so much, guys. Right, now it's time for our second presentation, which is from the folk from Gloucestershire, and it's from Hayden and from Roz. And just to let you know that after Hayden and Roz have spoken, we will have a short comfort break.
So my name is Hayden Price, and I work for Inclusion Gloucestershire on the Oliver McGowan Mandatory Training project. Also in this call from our project is Roz.
Hi, I'm Roz McDonald. I'm an occupational therapist by background, but I work for Gloucestershire and the Health and Care Foundation Trust, and I'm lucky enough to be project leading, so I'm on the call with Hayden today.
Our partners: Gloucestershire Health and Social Care, NHS Foundation Trust. Inclusion Gloucestershire, Family Partnership Solutions, Gloucestershire County Council. Here are our expert by experience, as you can see on the screen. Some of them have learning disabilities and some of them have autism and some have both. And the project team, so we have Rosie, Jackie and Dawn from Partnership Solutions, who are family carers with somebody in their household living with autism or a learning disability or both. And here are our more of our project team. So Ros, as she's just introduced herself, Wendy, who's the coordinator for the expert by experience guys in our group, Vicky, who is the CEO of Inclusion Gloucestershire, and Kate Ali, who is the clinician, with the Learning Disabilities team, Hannah Schilling, who is also a clinician with the Learning Disabilities team, and Anne, who is getting everyone booked onto our training and helping us make sure people are booked onto the right training and where they should be. So what have we been doing since August 2020 and June 2021? Well, we've now started doing things, delivering our training, and we've been doing it as a hybrid event. So for some of it, it's been 50-50, so half of the people have been in the room following guidance, COVID guidance on how many people are allowed in the room and socially distancing them, wearing masks when we're walking about and stuff. And the other half of the people join us on Zoom, and we got really good cameras and technology to be able to do that. And Ros is so wonderful at all the technical bits for the hybrid events that we do. What about our stakeholders? We hold once a month a stakeholders event where we talk to our stakeholders about what we are doing and where we are at, and if they've got any feedback or anything they think we should change in our training, add to our training, and just generally give us feedback on our training. So for tier one, we will always tell Oliver's story. That's the most important thing about the training. There will be an informative film on learning disabilities and autism, and there will be reasonable adjustments will be talked about. For tier one, you will have to do a video which will be about an hour and a half long, and then you will have to do a webinar which is half an hour long with somebody with a learning disability or an autistic person leading the webinar, and then there'll be somebody on the call just to help monitor the chat box and ask and get any questions that people want to ask us. And then at the end of that, you will receive a certificate. Potential workforce of over 30,000 people. We opened this training in May of this year. Tier 2 is a hybrid event following the lifespan, and it's 7 hours of face-to-face or online sessions, and at the end of each session, people get sent them through the internet a guidebook which has all the slides on it and all the links that we've used during the day, so they can go back and watch any videos that we've put into our training, because it takes so long to watch the whole video that we just show snippets, and then we let them look back at them if they want to at the end. And we opened this in May again of this year. Content reviewed by our stakeholders, A and QA by Public Health England and NDTI. Train the trainer sessions. We had a session where we trained everyone that was doing the work, the clinicians, family carers, and our expert by experiences, so we delivered it all together. And we've also adapted a handbook for each person who is presenting the training, so it follows what we've got to say, but it says it in a way that they feel more comfortable saying it. And so that's what we've done for that. And it's been designed and co-delivered by carers, expert by experience, and clinicians. We're trying not to just do towns and cities, we're trying to do rural areas as well, places that are hard to reach, that maybe people can't get to towns and cities. And we're also offering tier 1 to people in Bristol and North Somerset and South Gloucestershire. So that's what we've done so far. Thank you.
Brilliant. Thanks so much, you two. That's fantastic. Again, keeping your camera off, but let's just show our appreciation with our clapping function. Really appreciate it. And again, lots of great comments there from people very excited by what you're doing. Yeah, excellent, clear presentation. So yeah, lots of appreciation for you both there. So thank you so much. Okay, guys, we're going to take a short comfort break. I'm sure people have got kettles they'd like to put on and make themselves a drink. So I'd like to have you back, please, at 10 to 11, so 10:50, 10.50, as we say in my house. So 10 to 11, back here, please. If you keep your videos off, keep your microphone muted, then you can pop off and make yourself a cuppa and be back here for 10:50. All right, thanks so much.
Right, let's head back downstairs again. I want my phone back on again so I can work with the laptop. Grab a cuppa. Cannot believe it.
We can hear.
Hi, you're not on mute. Whoever's just making a cuppa.
Don't know what that means.
Yeah, you better do that quickly because my committee.
Unmute yourself, Tricia. Hi, everybody. Welcome back. I hope you managed to get yourself a cup of tea. Just a really practical thing that Kizzy's brought up that might be helpful for people. I know that Kizzy was struggling with chat popping up while people were presenting, and I was finding it really distracted. And actually, one of the things you can do is if you can slide it, you can click on it and actually pull it right to the edge of your screen so that it's not impacting your screen. I think that in preferences you actually can turn chat off, but I'm not going to start trying to do that now. But just to let you know, if you're finding chat distracting, then you can pull the actual chat box right away from your screen so that it's not actually obscuring the slides at all. I hope that's useful. Right, so we've got the second lot of presentations to do now, and the third presentation today is from Nikki from the MenCap National Autistic Society team. So welcome, Nikki.
Hello, thank you.
Over to you.
Thank you very much. I'm giving the update on the MenCap National Autistic Society Consortium as part of the Oliver McGowan Mandatory Training trial. We're really pleased to be involved with this project. These are the people and the organisations that make up our consortium. Along with MenCap and the National Autistic Society, we have Insight Autism, who are helping to deliver the training and co-chair the steering group. Carly and Jeremy are also part of the steering group. Be Well will be delivering some of the training in the Northwest. Access All Areas helped to make the films. I'm Nikki Stevenson, and I'm a director of Insight Autism. We've finished writing the training. Our learning disability and our autism training are separate. We'll be training lots of people who do lots of different jobs, including support workers, dental professionals, community nurses, hospital nurses, doctors, children's nurses, porters, social workers, occupational therapists, physiotherapists, and managers. We'll be training people across England. Some of the places we will be delivering training are London, the South East, the South West, East England, and the Midlands. We'll be delivering Tier 1 and Tier 2 training. Tier 1 is a half-day introductory level training course. Tier 2 is a full day's training and goes into more detail about autism and how we can help to support people. We'll be delivering our training. Coronavirus has affected our plans. We'll be delivering our training from July to the end of November 2021. We'll be training 2,534 people. We're really looking forward to starting to deliver our training. People with lived experience lead our steering group. They help design the training. They acted in the videos, our new training films, and they will be delivering the training. We want to show you 2 of the films that we've made for the training. The films have been made with Access All Areas and the scenarios were identified by people with lived experience. The actors in the films are autistic and/or have learning disabilities. The films will be used as part of the training. There'll be discussion and learning points that will be shared when they are shown. The first film is one that MenCap will be using in their Tier 2 training, called Meet Cayden. The film shows what happens to Cayden and his support worker when they are not listened to and when Cayden is not examined properly. The scenario includes learning related to people's unconscious bias and how these can negatively affect the treatment of people, and also includes learning about the law and people's rights. The second film that will be used in the autism training shows a more positive interaction with a doctor's receptionist. She understands autism and how this can impact accessing services. She puts reasonable adjustments in place to ensure equality of service for the person in the scenario. We really, really hope that you enjoy our films, and thank you very much for listening.
To me again. Then we'll go for the shot, Cayden, yeah? There we go. Come on, one more. Let's go. Back at me. That's right, Cayden. All right, ready to take a shot now? Cayden, you all right? Come on, where's the energy? You know this. It's a nice bounce pass, but now we're going to go for the shot, yeah, Cayden? You got this? All right, come on, give me a shot, Cayden. Show them what you got. Show them what you got. Remember the follow through. Ooh. All right, okay. Not to worry, not to worry. One more shot. Come on, Cayden.
Hey, Cayden. And how was that?
He seems a bit off colour today.
Yeah, I can see that. Oh, you're quite hot. Hey, come on. Let's get you home. Come on.
Take it easy, Cayden.
Cayden, I'm going to call the GP and see if this is something to worry about.
Apologies, we seem to have lost the video. I'm just trying to get it back.
Don't worry. It's a glorious thing with technology. It's wonderful when it works and not so good when it doesn't, but don't worry, we'll have the chance to get it back. So.
To me again. Then we'll go for the shot, Cayden, yeah? There we go. Come on, one more. Let's go. Back at me. That's right, Cayden. All right, ready to take a shot now? Cayden, you all right? Come on, where's the energy? You know this. It's a nice bounce pass, but now we're going to go for the shot, yeah, Cayden? You got this? All right, come on, give me a shot, Cayden. Show them what you got. Show them what you got. Remember the follow through. Ooh. All right, okay. Not to worry, not to worry. One more shot. Come on, Cayden.
Hey, Cayden. And how was that?
He seems a bit off colour today.
Yeah, I can see that. Oh, you're quite hot. Hey, come on. Let's get you home. Come on.
Take it easy, Cayden.
Cayden, I'm going to call the GP and see if this is something to worry about.
Apologies, I'm going to move on to the next film because there seems to be an issue with that one.
Not to worry.
To me again.
Just remember, everybody, you'll be able to see these at your leisure afterwards, so don't panic.
come on, come on.
Date of birth?
The 30th of August, 1989.
Oh, hi, Mr. Coleman. How can I help you today?
This morning, when I was looking at myself in the mirror, I was doing some stretches and I noticed a sort of lump on my back. I don't know.
Yeah, that's all right. Best to get that checked out. Let me see when our next available appointment is. We have a Tuesday evening appointment.
Oh, I work the night shift on Tuesdays. I have an important job. I'm a tube driver.
Oh, I understand. Let me see if there's a quieter time in the week when you're not working. We have an appointment on Thursday morning at 10 a.m.
I don't work on Thursdays. That would work.
Perfect. I'll book you in for a double appointment so you'll have a bit more time to get settled. It'll be with Dr. Hines. Is that all right?
Yes, that will be good.
Great. Just to let you know, sometimes the appointments run over a little bit, so there may be a bit of a wait, but we do have a quiet room where you can sit and we'll come and get you when the doctor's free.
That sounds good. It can be stressful.
I understand. Great, that's all booked in for you now, Will. And you'll get a text reminder the day before, just to let you know.
Thank you.
You're welcome. Goodbye.
Goodbye.
Good morning.
Good morning.
Hi.
Good morning. I have my appointment at 10 a.m. My name is Will Coleman.
Oh, well, what's your date of birth?
30th of August, 1989.
Great. Unfortunately, it's been quite busy this morning, so appointments are running late. So if you'd just like to take a seat.
Come on.
Oh, sorry. Well, I understand you're probably feeling a bit anxious. We have a quiet room that you can wait in if you prefer. I can come and get you when the doctor's ready.
Yes, please. It's stressful when things don't run on time.
Yeah, I understand. Don't worry, I've booked you in for a double appointment, so you'll have plenty of time. I'll come and fetch you when the doctor's ready. Yeah?
Thank you.
Brilliant. Thanks so much, Nikki. I say, please don't, somebody's made the point, sometimes we've got lots of people on the call, it's hard to stream videos, but please don't worry. They will be added to the website and you'll all get a copy of them after the sessions anyway. But thanks so much. Let's just show our appreciation with your clapping button. That'll be fantastic. It's very stressful when technology doesn't work. So, you know, well done. And lots of comments there about wouldn't we like to clone that GP receptionist? I can echo that one too. I'm actually very lucky. I've got a great GP receptionist. Fantastic. Okay, so our fourth presentation is from Pathways Associates, and we've got Vicky and Kizzy and Sean.
Hi everyone. Sean and Kizzy, are you there? Kizzy, you're on mute. Sean?
Hi, sorry.
Hi. It's okay. Kizzy, Sean, are you there, Sean? I can't spot Sean on my screen. I don't.
Let me see if I can see.
Sean. Oh, yeah,
there he is.
Sean, brilliant. Do you want to turn your camera on?
Can't do it.
Can you see the little video button in the bottom left next to your mute button?
Yeah, I know, but I can't do it.
Oh, it's not working. There you are. We can see you. We can see you. So shall we introduce ourselves and then I'll share my screen? So my name's Vicky Hornby and I'm the project lead. I'm lucky enough to be working with my colleagues on the Oliver McGowan Mandatory Training in Learning Disability and Autism for Pathways Associates. And my background is in co-production and advocacy and disability studies, and I'm also a trainer. Sean, do you want to introduce yourself?
Yeah, I would. And I'm Sean. I'm from the Manchester area.
I'm part of the Oliver McGowan Training and and the part of the Learning Disability in England.
Brilliant. Kizzy?
Hi, thanks Kizzy and, I mean not Kizzy, that's me. Thanks Vicky and Sean. I'm Kizzy Felstead. I live on the South Cumbria, North Lancashire border. I am a trainer for Pathways Associates and I have a background in social work and teaching.
Thanks, Sean and Kizzy. I'll just share my screen with our presentation. Oh, can you see my screen?
Yeah.
Brilliant. We'd like to take today to talk to you about how we've co-produced our Oliver McGowan Mandatory Training. Last stakeholder event, we talked a lot about what our training looks like. So today we're going to concentrate on how we work together to make it happen. Ooh. Sean, do you want to start?
Yeah.
Okay.
In our training partnership run by people with learning disabilities and autistic people. I can't see anything else now.
Oh, is the video covering it up?
Yeah.
Okay, so shall I? Do you want me to? Can you move the video, or shall I read it and then you come in a minute? Shall I read it? Yeah. Okay. So all our work is human rights based and social model of disability based, and the Self Advocates Training Partnership decides what training we want to go forward and deliver. So Sean, did you want to say what the Self Advocates Training Partnership is like, why it's important?
Important partnership is about getting a voice being heard. That means across 12 people with learning disabilities how to reach out, and we need to support people in our communities and health well-being and within our communities.
Brilliant, thanks Sean. Absolutely, it really is about getting our voices heard and improving things for our community. Kizzy, do you want to add to that?
Yeah, I think I'd like to add that every single person involved in the delivery of training at Pathways is passionate about making a difference and ultimately saving lives. We're passionate about removing the occurrence of preventable deaths, such as that as Oliver and others in our memories and our communities, due to needs but not being met or listened to.
Okay, so I'll just talk you through how we started, if that's okay. So our Self Advocates Training Partnership, as a group of people and colleagues, existed before we started working on the Oliver McGowan training. And so it was the partnership, people with a learning disability and autistic people, who decided that we should write a bid together. So we co-produced our bid and we asked our colleagues in health and social care to help us to come on board to be able to co-produce and deliver this together. And when our partners came on board, we set up a co-production group that helps us decide exactly how we're going to work on the project. They meet regularly every 6 weeks to check our progress and support us with any decisions that we need to make, and make sure that we've got everything that we need to cope with the changes that we're all coping through this year, and make any plans that we need to make changes. We're really lucky that we've got a fantastic group of partners supporting us that include self-advocacy groups, people with a learning disability and autistic people, family groups, as well as our health and social care colleagues. And some of those organisations in health and social care are big NHS foundation trusts, or some of them are little small community social care organisations. So we're really lucky to have a wide group of people. Sean, do you want to, shall I read this and then we'll talk about Train the Trainer? Can you,
yeah.
Or do you want to start?
You do that first.
Okay, all right then. So when we first started and we were successful in becoming a partner to trial the training, one of the first things that we did was run a train the trainers course so that we could invite more self-advocates and family members and practitioners to join us as co-trainers on the project. So we ran a training course over Zoom. We've run them before, but we've never done it before on Zoom, so it was really interesting to try that out. And we practiced, we had a team of people with a learning disability and autistic people, and we practiced all of the things that we would need to do together to run the training. And we do that so that we can make sure that every single part of our training is co-delivered by someone with a learning disability or an autistic person, or both. Sean, do you want to talk about what you did on the Train the Trainer course?
Yes. We have a group of people of different topics, and I did something around experience with people with Down syndrome. Someone did the history of advocacy, and some people did the people with autism.
Brill. So you all practiced, you made presentations yourselves and practiced delivering your presentations. And then we used some of those, didn't we, to help us write our training material on the basis of your experience. Thanks, Sean. Kizzy, do you want to talk about the Train the Trainers?
Yeah, so just like Vicky and Sean just mentioned, we all had a chance to write our own presentation on a topic of our choice, and then deliver that presentation and answer questions. So that provided practice and learning for us to become a trainer. This also enabled us and encouraged us all to become part of a strong, supportive team. All of the training is completely and utterly co-produced and delivered by professionals in the fields of health and social care, and also by us self-advocates. And we'll talk a little bit more about this in the next slide.
Okay, go on then.
I forgot it was me.
Yeah.
So our self-advocates training partnership meets weekly, and we meet weekly on a Tuesday at the same time. Originally, we were doing that, and we also had subgroups to meet and plan each module. So we had groups, in fact, pretty much all of us were involved in Tier 1, understanding my learning disability and understanding my autism. And then we broke into smaller groups to discuss various different topics for the areas that would be used in Tier 2. There were 47 people involved in the development of our work. We share Oliver's story in all of this training. We share it right at the very beginning. We also share our own stories and examples to help people understand how to listen to us and support us. So we like to also on the Tuesdays, along with so currently on Tuesdays when we're still meeting, and we like to use these sessions as development of ourselves as trainers, and we like to look at a variety of different topics which we bring as self-advocates. And these might include tweaking of training slides or online safety, for example. We take time to listen to each person, and our stories are always very different and personal. The other thing that I'd like to add is that when we deliver our training, we may actually deliver that in different groupings, different teams. So for example, one week we might, on one particular training, we might have someone, a professional from health, and then myself and Sean. That's just as an example. Another time we might have someone from social care and two other completely different self-advocates, or a mix of myself, another, or Sean, another, or whatever. But the learning and the training is essentially the same. So obviously we all follow the same slides. The only difference is the stories that we add. but as I say, the learning is exactly the same. And we feel that it's really important to let the people that attend this training see and hear the strength of the Pathways family, which is our training partnership, and it illustrates our respect for each other. And we hope that that respect and care for each other filters through to the front line, as it were.
Thanks so much, Kizzy. Sean, do you want to say anything about the Tuesday meetings, about the self-advocates training meetings?
Yes, adult care is very important to everyone in our lives, and we need to encouraging educators in England to support us in a way, and we need to, how we are strong become, and we're going to stick to the point of being learning disabilities, how we look at what we do and what we do best.
Thanks, Sean. Thank you. So finally, we want to share with you, if we may, one of the videos that we co-produced together. This video shows some of our trainers and co-trainers talking about their experiences, and it gives you a flavour of some of the stories, the types of stories that we share on our training, and how we've worked together. So I hope you enjoy it, and thank you very much for listening. And this is where we hope the technology works.
I always say that life's a bit like you in a movie and everyone has a script except you. So it feels like everything's going well for everyone, but you're sort of improvising and you feel a bit alien and a bit like an outsider.
I've had a 40-year business career. I've also had a 30-year career in and out of mental health. That's purely and simply as the result of trying to conform to what most people see as normal behaviour. I am not normal in the concept that most people use it, but I am not broken. I work very well, thank you very much.
When I was at school, I used to stand with a group of people, but I wouldn't really interact with them. I'd spend most of the time sort of watching how they interacted to try and act and be like them. It took so much energy to be able to sort of fit in with those people and learn when you're supposed to laugh in a conversation, when you're supposed to chip in and that sort of stuff. So by the time I got home every day, I was absolutely drained and I had no energy left. While that's sustainable in the short term, that can have a really negative impact in the long term. And so it got to a point where I was at university and I just had a bit of a breakdown because I'd had enough of everything. So I hid in my room for 3 months, and it was because I was in this mindset that the only way to be happy is to try and fit in, but no matter how hard I tried, I failed, and it got me into a really, really negative mindset. It was only when I reached out to autistic people online that everyone said, you're spending all of your time just trying to be normal and fit in, and you really need to learn to embrace who you are and accept your differences.
Just after this is just after I'd told the doctor about my mental health. I put it on Facebook, and there was like loads of friends like messaging me saying, oh, you fancy a chat, and yeah, and just got loads of support.
I did go a bit subdued in midway through my GCSEs. I found myself thinking that I wanted to take my own life. So I went and spoke to a psychiatrist, and after I had a couple of sessions with him, I started to calm down. I think it was just the stress that got to my head, and I was just taking it way above where I needed to be.
I really want to encourage people with learning disabilities to talk about mental health if that's an issue.
Thank you.
Brilliant, thanks guys. There you go, the technology worked for you. You were the lucky ones today, so well done. Thank you so much. So lots of really interesting comments again, people really relating to that in the video. Some really, really good stuff in the comments. So thank you so much for showing our appreciation. They're not quite big enough, these clapping hands, are they? Well done, thank you. Okay, so you've heard from the all the 4 people who are trialing this training, who are trying the training out. That's hard to say. Now I want to introduce you to the National Development Team for Inclusion, the NDTI, who are the evaluation partners. And we've got 2 Annas. So we've got Anna Marriott and Anna Levermore, and Laura also from the evaluation partner. So they're going to talk to us about how the evaluation process is working. So welcome, guys. This is the first time we've heard from the evaluation site, so it's really exciting to hear where we're up to.
Thank you. I will just share my slides. No videos, so less entertaining, I'm afraid, but
less stressful for you though.
I was going to say, but less technology challenges, hopefully. So can someone tell me if you can now see those?
Yeah.
I see them.
Fabulous. Thank you. So thanks for the introduction, Tricia. As she said, I'm Anna Marriott and I'm from NDTI, and I'm one of the 2 people project managing this work. My colleague Madeline, I believe, is in the audience today. But today I'm presenting alongside Anna Levermore from BMIX and Laura McConnell, who is part of our advisory group, and they'll be introducing themselves later when they share their bits. So we're just going to give a brief overview of the evaluation work and the progress we're making. And while we're doing this, we're going to try and address some of the questions that have been sent in. There were some that related to the evaluation, and we'll also talk about how we're working together to co-produce the evaluation. We've been hearing already how brilliantly co-produced all the sites are doing their work, but it's also important the evaluation is co-produced as well. So we have shown you this slide before, but thought today we'd focus on it as we're talking particularly about how we're working with our experts by experience. So both the delivery team and the advisory group have people with expertise around training, research and evaluation, and people with lived experience of autism and people with lived experience of learning disability. So Anna from BMIX is part of our delivery team, and she's one of the experts by experience who'll be collecting data through observations, which we've just started doing recently, and later focus groups. Laura is from our advisory group, and the role of the advisory group is overseeing the delivery, holding the team to account, ensuring we've got good co-production going on, and making sure the ownership of the evaluation activity and findings are all going well. We've got regular meetings throughout the course of our work. So the advisory group don't collect and analyse data, but we will at later stages present analysis of the data and seek their reflections on it. When we're planning each stage of the work, we start with a meeting with our delivery team, and after that we meet with the advisory group. We tell them what we plan to do, the progress we've made, and we ask for advice on that, and then we kind of have a cyclical approach to those things. So this slide is just to remind people, or for those who don't know, haven't been to these sort of meetings before, about the evaluation question. Essentially, there's 5 broad questions we're looking at. So what works in learning disability and autism training? But we need to know more than that. For whom, in what settings, roles and contexts? And I can see today from lots of the comments, people are talking about different settings, whether it's rural or urban, whether it's health or social care, and the different roles as well within those. So what are the challenges to delivering the training, and how might these be overcome? Well, again, some of those comments about all the different settings and roles are also some of the challenges that we face. We need to know what it costs to run the training, so we'll be collecting some fairly basic data about the costs. We want to look at how people with lived experience are best involved in the design and delivery of training, and you've been hearing a lot about that, but we'll be capturing some evidence on that from everybody's perspectives. And then ultimately, I guess this is really the fundamental training question: is the training making a difference to how people are working, and then to the experiences of the people receiving support? Ultimately, this is about getting better care and support for people with learning disabilities, autistic people and their families. So we have these 6 main stages to our planned evaluation work, and I'm going to go through them one by one and give you a quick update of where we are with them. So NDTI are the people specifically leading on the benchmarking work. So this is where we look at what the training is covering in relation to the capability frameworks. Now, there are 2 capability frameworks, one for autism and one for learning disabilities. And these were jointly developed at every stage by autistic people, people with learning disabilities, their families and carers. The frameworks describe the skills, knowledge and behaviour needed by health and social care staff working in all sorts of roles in relation to supporting autistic people or people with learning disabilities. Now, there is a lot to cover in those frameworks, so the sites have to think about the balance between including a lot of information and the length of their training. So the benchmarking, actually these slides were done a couple of weeks ago, and we're very nearly there. I believe it's going to be totally finalised certainly this week. So we're really close to having that all done now, and so lots of progress has been made around that. The second step is that everybody taking part in the training is invited to take part in the evaluation of it as well. We can't make them, but all the sites are working to encourage people to do so and to explain why it's so important they do. This is going to be mandatory training. We want to get it as right as possible for as many people and make sure it's effective. So everybody is asked to complete a survey before and immediately after their training. So in terms of that sort of thing, we're asking them questions around their knowledge and their experience and their confidence, and we compare that before and after. We also ask them for their immediate reactions about how they found the training, which bits of it worked well for them, what were the most important things they learned, how they think they can use it. So far we've had, getting on now for 1,000 questionnaires completed by people following the training. We've had fewer responses to the pre-survey, so we won't be able to make comparisons for everyone and how much they've changed, but we are getting a lot of feedback about what people think about them. Most of these responses so far are from tier 1, as only one trial partner started the more in-depth training when we collected this data. We do feed back some of the data to the individual sites, as this means they have a chance to address any particular issues raised. We don't want to wait until the end of it to tell them that people had some practical difficulties with accessing their e-learning, if that's something they can address at the time. We will be writing an interim report for October this year, once all the sites have started the delivery and then some data for each of them. So there will be something that's emerging for us to look at as we go. So the next stage is the observation. We've got an observation checklist and guidance, which again, these slides are already a bit outdated, is complete and now being used. We had a team meeting yesterday where we discussed the first viewing of some observation. We're aiming to do the observation work using videos of the training now. It means there's less impact in the sense of us being there and watching and observing. It also works better for the experts by experience doing it with us, because we can watch chunks of it and we can stop and start it and we can take some notes and fill in the checklist as we go. So that's how we're still sort of exploring the best ways to do it, but it seemed to be working well so far. Then we're doing surveys and interviews with people 3 months after they've done their training. And this is such a crucial stage of this work, because the follow-up survey is to find out if people have been able to use their training in the work, which, as I said already, is ultimately the point of all this. It's great if people enjoy the training and learn something, but if they don't do anything differently, anything better specifically, it's not hitting the mark. So that's where we're going to be doing that, asking people that. I think Build are just ready to send out their 3-month follow-up survey, and the others are ready and they can send them out at the right time. We're also, as part of that, asking some people, well, we're asking everybody, and we'll recruit a sample of people to have some more in-depth interviews where we can really explore some of the ways in which they've been able to use their training, and if they haven't been able to use it, what are the barriers? Because we're aware that people will also have limitations within their work and their work systems that might stop them making some changes they want. And we need to unpick those, because training doesn't happen in isolation. It has to be implemented within working places and systems. And then the last 2 stages, meeting with the participants and trainers. We have started to do some of that to capture some feedback on how the design's gone, but we'll be doing it at a later stage to think about the delivery and ultimately signs of change for people receiving services. As I said, that's really where we know the difference needs to be made, but we know that would really require longer term follow-up. So those stages of work are going to be done at a later stage, as late as we can manage within our timeline. I'm now going to hand it over to Anna Livermore. Hello, Anna.
Hi, nice to meet you guys. I work as an expert by experience for BMIX, and I use my experience of living with autism to hopefully change the way healthcare professionals treat autism and/or learning disability and those who live with it. We have had various meetings over the last few months with people from BMIX, My Life, My Choice and NDTI, so we can get a range of people and ability to look at putting together an observation checklist. This is so to evaluate what things we should be looking out for in supporting those with autism and/or learning disability in a range of settings. An example I mentioned is reasonable adjustments. and whether, let me just find it, sorry. And whether observation is used to suit the individual. As we know, autism and learning disability doesn't present the same for everyone. We want to look at how well this has been done. Do they explain what this is for? Are the examples matching up with what this may look like in a working environment? Most importantly, really, are they looking at the individual needs? My team have offered recordings of the training as I often zone out after a while. I can take a break when I want then. This is a great example of reasonable adjustments. I also said that we should interview people with or without experience of knowing or perhaps caring for someone with autism. We will get a wider range of answers that way. We will also look to give scenarios, as I think it's a good idea to see learning in practice. Further to this, we are now forming groups to do observations individually and then come together to discuss and evaluate our findings. This is by people with or without autism and a learning disability. Due to COVID, we have had to take extra time with this project, and now we can do regular meetings, which I find easier as I like routine. Thank you.
Thanks, Anna. That's fabulous. Laura, I'll bring your slide up now and hand over to you.
Hi, so my name's Laura Mcconnell. I'm really privileged and honoured to be speaking to you all today. My background is in education. I'm a senior leader in the education sector as a teacher. I also work in the media as a radio presenter in a disability focused radio show, and work as a writer for many publications, including the Times Educational Supplement. I'm autistic and I have a variety of other disabilities, and unfortunately I've had some quite poor experiences in the healthcare sector. That includes in the GP surgery on a hospital ward, and I saw someone in the chat earlier on mention maternity services, and actually that brought that to my mind. I had quite a poor experience in maternity services as well, and I'm really pleased to be part of the advisory group meetings, because I do really feel like I have been listened to and that I am valued and that my experience is important. We have regular advisory group meetings. They're lengthy and they are quite in-depth. We have a number of people with lived experience on the panel, some who are autistic, some who have a learning disability, and what we have to say is very important. One of the things that we did speak about, which I know that Anna Levermore has just brought up, was about the quality of reasonable adjustments, and a story that I shared was about a time when I was given a weighted blanket in health services, just because I'm autistic and autistic people like weighted blankets. Now I do like weighted blankets, but that's not really the point. It was as a tick box exercise, and something that we wanted to impress upon the group was that when, as part of this training, reasonable adjustments when you enter the healthcare service should not be a tick box. There should not be a list for autistic people. There should not be a list for people who have a learning disability. They should be personalised, and that's something that we really wanted to impress upon everyone. And we know that that is now going to form part of the case studies as part of the advisory group, and also the delivery group's recommendations. When the training is being evaluated, there will be, for example, a case study where it looks like the service has followed all of the good information. It looks like they've put a lot of reasonable adjustments in place, but it might not have been personalised. So that's something that from our input will have formed part of the evaluation. Also, something that we were really keen to impress upon the group was about unconscious bias, implicit bias. We know that it is important for doctors to be trained, because doctors are essentially the patient care decision makers. They are the people who can influence where a patient is, where a patient goes, and the medication that they have, and that can be fatal, which is why we're all here. But doctors only have I suppose a small period of time with patients when they are in hospital, and nurses and receptionists also have a really important part to play. In fact, every single person that you encounter in the health service has a really important part to play. So in fact, one of my particular experiences was with a receptionist who mocked me for forgetting to order a prescription. I have ADHD, and being forgetful is part of my neurology, and it occurred in front of many other patients. So we know that while it is important for our doctors to be trained and our doctors to have to have better working experiences with autistic people and people with learning disabilities, we know that it is important for all of our receptionists and other staff to be trained, so that people aren't forced out of the healthcare system, so that people want to actually access the healthcare system. So we're very pleased that frontline staff are being trained, and obviously that these messages will be looked at within the training and also as part of the evaluation of that. And there will be discussions around unconscious bias that influence the analysis of the training, and hopefully we will be looking at the way that people who have experienced autistic people with learning disabilities, and how they felt about them before, and then later on after the training, if that has influenced them. So it's been a wonderful project to be part of. I do really feel that I have been listened to, and anyone who has lived experience that's out there in the audience knows how rare it is to feel that you are actually listened to. As I said, I'm from the health sector, the education sector background, and it's very rare there. So it has been a really good experience, and I'm really looking forward to all of the work that we're going to continue on with.
Brilliant, thank you so much, Laura and Anna. And that's it from us, really. I just want to say that we're at a really exciting stage of the project. You know, the training is now finally kicked off for all the sites, and we've got some we can start doing some follow-up from, and we really look forward to sharing findings with you as they emerge. Thank you for your time.
Brilliant, thank you guys so much. That's fantastic. Really good to hear, how we're actually looking at how well the different bits of training are working. Again, lots and lots of interesting comments in the chat. So appreciation, please. Love, lots of clapping. Excellent. Lovely, thanks so much. Okay, so the final part of our session today is to answer some of the questions. And I just want to remind you that there are already the answers to lots of questions, including some of the questions I've seen coming up on the chat this morning, are on the Health Education England website under frequently asked questions. Okay, everything that's a new question that's come up in the chat will be added to that, but we are going to answer some of your questions now. So we've got two more people to introduce you to. So we've got Tim Devonates and Ona Smythe from Tim from Health Education England, and Ona Smythe from Skills for Care, and Paula McGowan, who you've obviously already met. So if you three can turn your cameras on, that'll be fantastic. So I can see Tim, I can see Paula. I can't see Ona yet.
Can you not see me,
There
Trisha, when I
can
talk?
see you now. No, it's all right. I can see you now. That's fine. That's great. Thank you so much. Brilliant. So we've got some questions that we're going to go through from the ones that people have sent in. But I just wanted to start us off first with a really important practical question that somebody had sent in, which was, I'm autistic and have ADHD, and I do not know what to expect and can't always process information in the moment. Can I ask questions afterwards? So it's just a reminder that yes, absolutely, questions can be asked at any time. So we're taking questions from the chat and we'll feed them back to you afterwards. On the Health Education England website, there are already lots of questions which have already been asked, so please check there. If your question isn't there, or if you need more help with this, then please email Health Education England, and I think that's going to pop up on your chat in a second with the email address. There you go, look at that. That's seamless, that is, Sarah. So the email address is policy@skillsforcare.org.uk, and it's there in the chat. And just make it clear that your question is about the Oliver McGowan Mandatory Training in Learning Disability and Autism. But at any point you can send questions in, but keep on going back to the frequently asked questions section, because there's loads of stuff there already. I've seen quite a few questions in the last section about rollout, and just those questions have been answered in the frequently asked questions already. So I'm going to hand you over now to Tim to start off with answering some of the questions that people have sent in advance. Off you go, Tim. Thank you.
Thank you. Yeah. Okay. So first question we have here is: Can you say more about when and how people outside the trial can start using the training material? And so we expect to share the training material along with guidance about how to involve people and which staff need to do which training after we have the evaluation report from NDTI. And at that point, we'll establish a delivery model for the Oliver McGowan Mandatory Training rollout. The next question is, can you say more about current thinking about rollout and how will this be rolled out to hospital trusts? So it's really important to us to have the experience of people who have been trainers and employers to be part of the evaluation. And again, our evaluation partners will summarise the learning and make recommendations based on the evidence they gather during this trial. That learning will be fed back to the Department of Health and Social Care, and they will use it to inform what the rollout looks like. But yes, the training will certainly cover primary care, hospital trusts, and social care. The next question is about the core capability frameworks and how much of the core capability frameworks will the Oliver McGowan Mandatory Training cover whilst keeping the training concise. So it's important to say the training is mapped to the core capability frameworks. The core capability frameworks are extensive, particularly at Tier 2. The Oliver McGowan Mandatory Training will focus on the key parts of the frameworks that will help change culture and prevent health inequalities. So as such, it focuses upon understanding what autism is, understanding what a learning disability is, reasonable adjustment, appropriate communication, preventing diagnostic overshadowing, and applying the Mental Capacity Act. How will the mandatory training be funded? Will organisations be expected to fund the delivery of mandatory training? Again, it's a similar response to before. We want this training to be robust and evidence-based, which is why the wider rollout and how it's funded will be informed by the evaluation. May I hand you over now to Paula to answer the next set of questions.
Thank you, Tim. My question is, how much time will it take to deliver Tier 1 and Tier 2 with each of the 4 stakeholders? And the answer is we don't know at this stage how long the training will take to complete. This is something that will be established once the trials are complete. And to give some indication of current timeframes, in the trials, we have training that ranges from Tier 1 training lasting for 2 hours through to Tier 2 training, which could take 2 days. The next question is, will the training courses be able to be delivered by internal trainers within organisations who employ them? And the answer, this is a question that many people are keen to hear. We will only be able to answer that question when we have a delivery model for the rollout. The next question, we would like to start using your materials to ensure a high quality standardised approach, ensuring all key messages are appropriately made within our sessions. When can we use your materials and how do we get hold of them? And in answer to that, it's great to see that so many people are keen to use our high quality training material from the trial. Only when it has been tested and is deemed ready for release will we make it available. And the final question from me is, has work started yet on Tier 3 training for those with more knowledge and skills, such as those working in learning disability teams, to ensure consistency of understanding and practice across the country? And the answer is Tier 3 capabilities are not in the scope of the Oliver McGowan Mandatory Training. There are many ways in which all tiers of the capabilities frameworks can be achieved, including professional training, on-the-job training, supervision, awards from education providers and advocacy groups. I'm now going to pass you over to Una. Thank you.
Thank you, Paula. So I have a question around the role of learning disability nurses in delivering the training that someone was interested in. So you'll have heard today that we're currently looking at the content of the Oliver McGowan Mandatory Training and its quality. And whoever delivers that training will need to have the right values and the right knowledge and skills to deliver training that really makes a difference. And we expect that that's going to be a wide range of people. And a wide range of people who might play that role, but none of that has been decided yet. But it is something that that we're thinking about. And then the next question is, how are you going to ensure that this actually makes a positive difference to the hospital experience of autistic people without an intellectual impairment? And as you heard from NDTI, our evaluation is going to look at the training and the impact it has on staff and their behaviour. It's also not the only thing that's happening. So there are other things like reasonable adjustment flags, the autism strategy, STOMP, all of which are part of changing culture and addressing health inequalities. And together, these things may bring about the changes that we need. Longer term studies and evaluations will be the things that determine whether or not they have been successful. The next question for me is how are you making sure that the training covers the cohort of autistic individuals who do not have additional learning disability? So the trial is going to look at the best way of delivering the content based on the learning disability and the autism frameworks. Trial partners will design the training or have designed the training to include autistic individuals who do not have additional learning disability. Our evaluation partner will review the trial data and ensure that the recommended training covers people with a learning disability, autistic people, and autistic people with a learning disability. And then the final question, is this training for England only or for the 4 UK countries? So the Department of Health and Social Care is only responsible for health and social care in England, and so this training will only apply in England. However, there have been similar petitions and discussions in Wales, but the Oliver McGowan mandatory training will apply to England only. That's all from me, Tricia.
That's brilliant. Thank you so much. Really helpful to hear the answer to those questions. And I think the huge theme there through the questions is there's people are really keen to get started. And I really appreciate that. But the whole point of this trial and the evaluation is that we gather the information from the evaluation and get all that sorted before you can actually get out there and start making the training happen. So thanks everybody for their presentations. Thanks to Tim, to Paula, to Ona for the questions and answers. I really hope that you found it informative and that even if you came to the last stakeholder event in February, that you've got a better understanding of where we are today. I think from the chat, following the chat, it feels like people have found it incredibly useful. So we can't stress the importance after today to spread the word of the training. Tell your networks, colleagues, friends, that it's definitely going to be happening. Yeah, definitely going to be happening. So make sure you get the word out to people. We're going to work to update the frequently asked questions on the website over the next 3 weeks to include the questions you've posted in the chat today. And we'll also upload the recording of this session and any partner presentations. We do now have a future date for the next public forum, which is likely to be the 1st of December. And hopefully we'll have a lot more information to share with you by then. So on that note, we'd like to say thanks once again for your attendance today. It's been a real pleasure to be here and keep you updated with our progress. Usually I'd have said have a safe journey home or stay in network and chat to each other, but obviously in these times I can't say that. So I'd just like to wish you well, stay safe and thank you. And I'm going to close the meeting now and end the Zoom session. So bye-bye everybody. Lovely to spend time with you. Bye-bye.